Are you worried about trying again after a miscarriage? Are you scared that you'll never be the parent you've always wanted to be? Are you pregnant after loss or after fertility treatment and just waiting for something bad to happen? Pregnancy is not always blissful, like it can be shown in the movies. Aren't we supposed to be glowing and happy all the time? Pregnancy can be full of worry, fear, and anxious thoughts. On today's episode of the Baby or Bust Fertility Podcast, we welcome somatic trauma professional Parijat Deshpande to discuss anxiety in pregnancy, miscarriage, and infertility. Welcome to the Baby or Bust Fertility Podcast, the podcast with interviews and in-depth discussions on all things reproductive health, created to support anyone curious about infertility, miscarriage, and early pregnancy. I'm your host, Dr. Lora Shahine, a double board-certified OBGYN and reproductive endocrinologist and former fertility and IVF patient myself, helping build families for almost 20 years and dedicated to supporting and educating you on your family-building journey. Parijat Deshpande is the founder and CEO of Ruvelle, the only trauma-informed wellness company specifically dedicated to improving high-risk pregnancy outcomes. She is dedicated to supporting patients on the entire high-risk pregnancy journey, whether it is through her live events, her one-on-one work, her best-selling book titled Pregnancy Brain, A Mind-Body Approach to Stress Management During a High-Risk Pregnancy, or her podcast, Delivering Miracles. Parijat, I am so excited to connect with you again. The last time we connected, I was on your podcast, Delivering Miracles.
Yes, that's right. And it was, and still is, such a popular episode on Delivering Miracles, let me tell you.
Oh my gosh. Well, I mean, I've known you for so long. I first found you on Instagram, and then I referred patients to you, for counseling. And then you came out with your book, and, you have just done so much to help so many people through anxiety and pregnancy. And now with your new company, Ruvelle, you are a somatic trauma professional, and I'd love to just please explain to me what exactly that means.
Yeah, it's a really generic term that essentially means somebody who guides people through learning about their bodies to navigate the post-trauma world, if you will. So a lot of it is about kind of think of it like a physical therapist or a trainer, but for trauma specifically, where we get to dive deep into your body. You get practices and exercises and really focus on the body's expression of traumatic stress.
And just for listeners, what does somatic mean?
Oh, yeah. Great question. That just means body related. So that can be anything. So a somatic trauma professional could be a trauma-trained massage therapist. It could be a trauma-trained yoga practitioner, right? It could be anybody that does anything with the body. My focus is specifically on neurosensory work and the neuroendoimmune support that we provide. So that's kind of my specialty, but somatic trauma professional is kind of the catch-all term for that.
I'm really excited to talk to you today. I'd love to first kind of go through your motivation, your story and your motivation to really help other people with anxiety and high-risk pregnancies.
Yeah. I'm not sure we have enough time, so we'll see what we get through. I mean, long story short, I was the person. I went through infertility myself. I went through fertility treatments myself. I went through losses myself. I went through a very high-risk pregnancy myself. We had an extremely preterm delivery, lengthy NICU stay, and then life that comes after that, because it's not over just because baby comes home, And so it was that lived experience really that was so mind-blowingly eye-opening about what the experience is like when you are actually going through it compared to what you learn about it theoretically. What do you actually, I laugh about it now. It was not funny back then, but the year prior to me starting fertility treatments for my cycle that ended in the extremely preterm delivery, I was teaching developmental psychology at my alma mater, talking about the developmental challenges of babies that are born at 1 pound, 2 pounds. And I look back at that now and I go, what exactly was I teaching? Because that lived experience was completely different than before. And that really started with the fertility treatment completely, of just not knowing. You hear, you read what it could be, quote unquote, and then you go through it yourself and you go, oh, this is what it is. And that's so wildly different.
Yeah, that's like me being a fertility doctor and struggling to have both of my children and doing IVF and the whole thing. I know it's a totally different experience, but just being in that world and teaching and learning and then also becoming the patient or the person that this is sort of happening to is dramatically different. And so
Yeah.
that kind of leads to my next question is, what did you take away from your experience? You had this sort of academic look and sort of studying from afar, and then you have a lived experience. And what did you take away that you wanted to share with other people?
The way that I like to talk about it is there's what happens in the exam room that your provider knows and that you share that information with. And then there's life that fills in those gaps. And it's in those moments that I think really the impact of, say, fertility treatments or the after effects of loss or, anything that we're going through, that's where that really takes root and what really kind of shapes your experience of it, who you are, and what you take away from it. And I think it was that experience that was very compelling to me to address, because I had the most amazing medical team, from fertility clinic through MFM, through NICU, through pediatrics. I mean, the whole gamut. I just could not have been luckier in that way. And yet, even though I basically lived with my perinatologist at one point in my pregnancy, there was life that was happening at home that she was not privy to, that those little moments she didn't see, the nuances she didn't get, that she didn't live through because I was there by myself. And that really truly started even through the fertility treatments. It's those moments of real life that I wanted to go, okay, you could have the best care team in the world and still there's more support that everybody needs and deserves. And that's kind of the impetus for doing this work.
Yeah. I knew you, I referred patients to you before you wrote your book, Pregnancy Brain. And I was really excited for that to come out when I read it. And I learned a lot more about you and the research. And I felt a turn in sort of your counseling, even your Instagram posts, because I felt like with Pregnancy Brain, you were really trying to teach us a lot about anxiety and the nervous system and how it can impact your overall health and well-being. And instead of the typical recommendations that most people will get, like just relax or go to therapy. I mean, therapy is great, but I'm just saying, like, you are actually really delving into the science and saying, this is what is actually happening physically to your body. And these are things that you can actually do to relax and, sorry, I know I hate that word, decrease this amped up nervous system and improve your overall outcomes. And it felt empowering. There's a real tension between trying to teach someone what you're teaching, but also not bring on more shame. Like, oh, if you would just relax more, then you wouldn't have preterm contractions, or anxiety wouldn't cause your infertility. So I'd love to kind of get more into actually what you are teaching now. And one of the coolest things that I was reminded of when I was getting ready for this is that you actually talk about anxiety in pregnancy actually has an evolutionary benefit. And can you talk about that? Because I just think of always anxiety as a bad thing. And I was like, oh, this is a different way of looking at it.
Yeah, isn't it? I think that's why I think that shift happened for me in how I'm talking about it, is really to show, and it comes from a personal experience again, of I want to know why something's happening. Because if I don't understand why something's happening, it's scary and it's overwhelming, and suddenly I lose power and suddenly I go, oh no, when's the anvil going to drop on my head again, right? But if I can understand even a little bit about what might be going on, then you get some of that power back and you go, oh, okay, I'm not broken. I have choices. There are things that I can do, and I could choose not to do anything. But the choice is mine, right? I think that's so important. And I love that you bring up that example of anxiety as having an evolutionary benefit, because on two levels, right? Physiologically, we know that there are changes to the sympathetic nervous system and all the branches that are tied to the sympathetic nervous system. And we know that through pregnancy, as you go through pregnancy, that changes. that's supposed to change to support your pregnancy in very specific ways through each of the different gestational weeks. And because of that, that in and of itself can tell us we really can't pathologize anxiety during pregnancy because that baseline is changing all the time. But secondly, if we think about the experience of pregnancy, if you are the pregnant person, you are growing a brand new human being. And in order to actually protect that human being from conception, essentially, or from when you find out that you're pregnant, you're going to be more alert. You are going to be more aware. And that can often look like anxiety. Sometimes it can even feel like anxiety. But is it really pathological anxiety? I really don't think so.
So I love hearing like a positive stance on anxiety, but it can feel really horrible to be so anxious and waiting for something bad to happen. A lot of my patients have had a miscarriage before, and being pregnant again, it's just, the anxiety of waiting for bad news, or they've worked really hard. It's their first positive pregnancy test after an embryo transfer, and they go to the bathroom and they're waiting to see if there's signs of miscarriage, so just this constant anxiety. How do you counsel your clients and teach what is normal, in big air quotes, because I hate that word. There's no definition, but what's typical or normal anxiety versus like, oh, this is like your sympathetic nervous system is so amplified, like we really need to kind of calm it down. How do you figure that out?
Yeah. Well, we start first with acknowledging that what they are reacting to, whether that's waiting for the test results, it's waiting in that 2-week wait, it's going to the bathroom and seeing what's going to happen, all of that is impacted by something they've already been through before. And I think that is something we don't talk enough about, is there is a difference between being scared about something that could happen because you've heard stories about it, because you think maybe it could happen to you, versus I have lived experience of going to the bathroom and seeing blood.
Mm-hmm.
I have lived experience of waiting and spending all this money and time and energy and pouring everything into it, only to get that negative test result, get that call from the clinic and say, I'm sorry, it wasn't this time,
Mm-hmm.
right? You have lived experience of that, which means what you are reacting to is something completely different. Something completely different. And we talk about this in Pregnancy Brain, about that difference between fear versus anxiety, and it being a present moment, kind of a present day experience, a present moment experience of it's happening right now. And I'm reacting to that, and I'm reacting to it through the filter of something that I have been through before. And I think that's so important to carry with us because, again, I'm all about the depathologizing of this experience. It takes us into this new world where we're not going, what's wrong with me? We're going, what is my body telling me? What is happening right now, and what is it telling me? And that's where we start. That's where we always start. We can't do any kind of work on ourselves in any way, whether it's going to the gym or changing our diet or doing nervous system work, if we're carrying the shame around of there's something wrong with me, I have to fix it.
Oh,
it'll never work. That's never a motivating factor. I know I would never do anything, no matter how good it was for me.
Yes.
If I felt like I was doing it because I was broken or I needed to be fixed.
Yeah, you're describing how I felt and how so many of my fertility and miscarriage patients feel. I'm broken. There's something wrong with me. I'm doing something wrong. And so I heard you say the first thing is acknowledging this lived experience and these feelings. And then it sounds like the second thing is kind of to recognize what's going on in your body. And can you give examples of that?
Yeah. So the words anxiety, fear, stress, they're such vague terms and they can mean such different things to so many people. And so getting really specific in your own body. What's happening in my body right now when I'm getting ready to go to the bathroom, when the phone rings and my heart jumps out of my chest, or what's actually happening in my body? Because what's happening in my body is going to be different than what's happening in yours. And what's happening in my body is going to tell me, one, where I've come from and what I need to do now to support myself to get through this next moment. So we have to really pay attention to what's happening inside. Is it my hands are getting clammy? Is it my heart's racing? Some of those things are easier to figure out. the gems, the gold nuggets I have found we discover when we figure out how we are bracing for impact. Because that posture that we go into, and we all do it, that tells us about what I call the incomplete threat cycle that did not complete before. The last time I had a miscarriage, the last time I went through an IUI cycle, the last time I insert whatever you've been through. That's where we get to then figure out, okay, that's where the work begins.
That's amazing. And then what kind of things do you coach your clients through to sort of calm down this heightened response and sort of, what's the right word? Like not de-stress, like what words do you use?
I use the words complete the threat cycle. And that gives it so much action, which kind of pulls away from the idea of calming down. I really, if I could do anything in this world, it would be to tell people to stop calming down.
Please, that's great. We need a t-shirt. Stop calming down.
That's right.
Oh my gosh.
Because if we think about it physiologically, what's happening is there was an actual threat. There was a threat to our bodies, and it could be something like needles from our fertility cycle. It could be the threat to our life. I know when I was pregnant for the first time, I had a ruptured ectopic pregnancy. It did not register until afterwards that, oh, wait, my life was actually in danger as well. But then I also lost a life in the process, right? So if you have a miscarriage, there's an actual loss of life. So we have to, again, acknowledge what actually just happened that justifies and makes what I'm experiencing right now make perfect sense. And then from there, we have to remember that when we went through whatever that was that we went through, cycle after cycle or just uncertainty, we prepare, we brace ourselves for some kind of a threat. And when that happens, our body is in active mode. It is trying to do something very actively. And if we try to calm ourselves down in that process, what we're actually doing is trying to put a lid on a pressure cooker. And that's where we start to see stress-induced illnesses come from. Instead, I say, toss out calm out the window. We're not going to go there. We're going to figure out what's going on in the body and use it. We're going to mobilize your body. We're going to move you in a way that allows you to metabolize that energy. You do that, the calmness will come. The relaxation will come.
Okay, so
that's later.
Totally different concept, and I love it. Like completing the threat, acknowledging, figuring out what your body is doing, bracing for the threat, not trying to ignore these feelings or feel shame around feeling this threat, but completing it. And can you give me some examples of what you could do physically to complete the threat?
Yeah. So let's take an example that's not related to reproductive health for a second, just so we can all see it from a different angle. We all go through threat cycles. We all experience them. And a great example of that is if you're walking across the street and you see a car coming a little too fast at you, what happens? Right? We go, oh, and we either stop or we run or we do something, right? That's going to get us out of the way and keep us safe, right? That's an entire threat cycle. Another example is we're driving a car and everything's going fine. And then from the corner of our eye, we see a car coming a little too close. And what do? We grab the steering wheel and we turn ourselves out of the way. That's the beginning of the threat cycle, right? And normally that's where when people are talking about stress in kind of this pop psychology way, that's all they focus on. And they go, all right, well, it's over now. You didn't crash. You didn't get hit by the car. Calm down. But if we pay attention to what actually happens in those moments, you're in the car, you're driving, you almost get hit, but you don't. Think of what happens in the moments after. There's a very predictable pattern that our bodies go through. We recognize our external senses first. So we notice, oh, I'm holding really tight to my steering wheel. I start to feel hot. So I'm starting to notice now my internal sensations. I start taking off my jacket. Oh my gosh, my heart rate is through the roof. I'm noticing now all of that. It all unfolds in a very predictable way until I can then hear the music that's been playing this whole time that I couldn't register before. And at the very end of it, I turn to you and I go, oh my gosh, can you believe that guy almost hit us? That happens at the end. And what we tend to do is we reverse it and we go, let me talk to you about what I went through just now. Again, I'm a former therapist. I have a lot of value and respect for the field of psychotherapy. But what we know about stress physiology is that has to come later. We have to let our body do the rest of it first. So how do we put that on if we weren't able to do it at the time of the IVF cycle, at the time of that phone call, at the time of that loss? Well, we have to understand where your body is right now, which is a really dissatisfying answer, I realize, because I don't have a 3-step plan for anyone that's listening.
I'm listening. It's such a different way of thinking. I love it.
Excellent.
But it's more understanding rather than you just telling me, oh, do box breathing and you're going to feel all better. And I'm not trying to like throw off box breathing or something. It is a really different way of thinking about it. And you're even using language that's new to me, which I like. It's a threat. You're running from a bear. When you're in that threat mode and you're running from a bear, you're not going to hear music that's playing in the background. You're not going to notice what's under your feet. And you can teach your body to realize that you're coming out of that threat when you start being able to pay attention to noises and feels and smells around you.
Exactly.
Yeah, you did a really good job of going through this in your Delivering Miracles episode on pregnancy and anxiety. I think it's 126. So if anyone wants to hear more about this specific topic, I think that's a really good episode, and we'll make sure and link it in the show notes. We're going to get back to talking to Parijat all about anxiety in just a second. I want to take a moment to remind you just how important it is to review and rate the show. And instead of reading a review this week, I am going to answer a question from YouTube. So you can listen to this podcast anywhere you listen to podcasts, Apple Podcasts, Spotify, but we also upload it to my YouTube channel, Dr. Lora Shahine, every week. And on YouTube, I often get questions, and I want to answer one of your questions that came up on one of the most recent uploads of the podcast to the YouTube channel. So Megan, thank you for asking this question. Here's what she said. The HSG was the most painful experience, ! I am so sorry, Megan. I wasn't fully prepared for how painful it was going to be, and I don't understand why pain medication isn't given. I agree with you 1,000%, Megan. So for people who are listening, an HSG is a test. It's a common fertility test called a hysterosalpingogram. Hystero just means uterus. Salpingo means tube. Gram means study. And what happens is we put a little tiny tube into the cervix and put fluid into the uterine cavity and watch it spill through the fallopian tubes. Now, this is the only way that we can make sure fallopian tubes are open. And if people have blocked fallopian tubes, it's one reason people might not be getting pregnant. So it's a really common part of a typical fertility evaluation, along with a semen analysis and other important tests. Now, this test can be crampy. It can be uncomfortable. Your fallopian tubes are delicate. They're not used to having fluid flushed through them. And for some people, it can really be very painful. Not for everyone. Most people are recommended to take Motrin before the test, but even then, people can sometimes feel a lot of pain, and I have always hated that. And so that is why I decided to do something about that in my practice. It took us a couple of years, but we now offer pain control in my practice at Pacific Northwest Fertility in Seattle, and I'm really proud of it. We actually have nitrous in the HSG suite. This is laughing gas. This is what people often get at the dentist when they have a dental procedure. It works really, really quickly. It wears off really, really quickly. I actually tried it myself because I wanted to be able to, recommend this or talk to patients about what it's like. And it makes you feel loopy and lightheaded, but you're not out of it. You're not passed out. You know what's going on. You can talk to people, but you don't feel as much pain. And it is pain relief. So instead of women just being told to suck it up, bite a piece of leather and take a shot of whiskey and just kind of deal with pain for a diagnostic procedure, which it feels like was what we've been told forever, you can offer women pain control. I think that we are the only clinic I know of in Seattle for sure, maybe on the West Coast, maybe in the country. I'm not sure if any other, clinics are offering pain control for their HSG, but I am proud of the fact that we do, and it is not okay to be in that much pain. So I'm with you, Megan. Thank you for asking this question. We've got to take pain seriously in women. Now, we should also take anxiety very seriously in women. So let's get back to the show and talking to Parijat. Where did you learn about this? Like, where can people learn more about this theory? Are there books to read? Is there a class that you took?
This was a combination of, this is going to sound wild, but going through my clinical training, there was always a little voice in my head going, something's missing here, but I didn't know what it was. And I couldn't articulate what it was. I didn't know where to look because I didn't know what questions to ask. So I went through the clinical training with that little voice chirping in the back of my head. And then when I was on bed rest in the hospital before my son was born preterm, I followed instinctively what I needed my body to do in that moment. And then it was tracking what happened after he came home from the NICU and going, why is therapy not working? Why am I just so frustrated with the process that I spent all these years training for? And so it was a combination of like recognizing where those missing pieces were for me, and then pulling in what I knew and what I'd already started kind of building with and then added my training onto. So it's an amalgamation of a lot of different theories, from somatic experiencing, sensory motor work, neurosensory practice. Like there's a variety of different things that I've pulled together, because I think something we have to recognize that's different about trauma or chronic stress when you're going through fertility treatments or pregnancy or after birth trauma or really medical trauma of any kind, surgeries even, is that it's such a heavy body experience, right? It's happening so viscerally to the point where there's so many moments where you're not thinking because you cannot think, because physiologically you're not supposed to think in those moments. And it's such a massive visceral experience that we really have to meet the body where it is and go, okay, we'll do the body-based stuff first, help complete those cycles so that we can then benefit from the connection and the talking and the thought-based exercises that seem to pervade kind of all of these.
So many times people want to just rush through, like okay, next transfer, next pregnancy, like just give me the baby because that's the ultimate goal. And it's hard to tell people like, okay, just slow down, like that doesn't work, or just calm down, but I do try to explain, like at some point you've got to do this work. You've been through significant trauma, whether it's months of negative pregnancy tests or failed embryo transfers or miscarriages. And that trauma doesn't magically end when the baby comes home. I mean, yes, you have your goal. And a lot of people are able to magically just, I don't know, put that trauma in a little box and put it on the shelf and not think about it again. But I do think it stays with you, and finding ways, maybe it doesn't have to be right now, but at some point you've got to work through that, because it really does leave a lasting impression. I don't know how to say that in the right words, but I love that you're acknowledging it. Truly.
I know, exactly. And some of the words that you can even use include somatic memories. We don't have to think about it. We can erase it completely from our minds. There are memories when we go through something really physiologically shocking that we don't have cognitive memories for, but our body remembers, and it remembers through the postures that we sit in and you can notice it yourselves anytime right now. When you get nervous, what posture do you sit in? When you feel scared, how do you move your body, and what parts of your body move more and what parts of your body move less? Because all of those are telling the story of that moment when that car almost hit, that moment when the bear is chasing you. That's the moment that's being retold over and over. And I think you were talking about earlier about balancing that line. I think this is where I find talking about it physiologically is so important, because it does have an impact on reproductive health and perinatal health, because of what the nervous system can do to alter the endocrine system and the immune system, which is what we see repeatedly, both through fertility treatments, through pregnancy, but also afterwards, when we're just kind of, even if we're not pregnant, even if we don't have children, this is where we start to see those pieces come together to make sense of what's happening in our body and otherwise in our health too. And that's why I think it's so important, is we don't have to think about it. And that's what I tell my clients. We don't have to talk about it. You don't have to tell me what happened, because your body's going to be telling the story anyway. It's already telling the story. So let's listen there. And then let's complete the cycles. And then you can be on your merry way. I mean, I'm oversimplifying it, but it also isn't that complicated either when we listen first instead of pushing through what we think we're supposed to be doing.
Yeah. Well, and I also was very interested in a lot of what you talked about in your book and in your podcast about how working through this, calming this anxiety, calming this part of this overhyped part of your nervous system can actually improve pregnancy outcomes. And I just want to acknowledge the tension there, because I love learning that, because I love to empower patients to be able to take back some of the control and something that they feel so out of control of. Like, if you can work on this and you can calm your nervous system, you can have improved outcome. But the other piece of that is, I do worry that if they still deliver early, are we adding to shame? Like, oh, well, you didn't do as good a job as calming your nervous system. How do you, right? So how do you balance that tension of empowering someone with knowledge and tools, but also not making it more of that cycle of shame?
I think it comes down to acknowledging again, and they know this, but it's really putting it into words so it's all out there on the table. It's complicated. And what we are doing is we are stacking the deck in your favor. I think of it kind of like when pediatricians kind of guess what your height's going to be when you hit adolescence and how tall are you going to be ultimately. I always think about that because they told me I was going to be taller than I ended up being. But like there's a range, right? And we have control within that range. I delivered at 24 weeks. There was zero chance I was going to make it to 40. But could I have made it to 25? Maybe. Had I known all of this back then, maybe. And I don't hold that with me. And I share that in Pregnancy Brain. I don't hold that as like I should have, because I did not know what was going on. It was a whole experience. But I think that's how I like to think about it, is what is that window within which we have that control? And I think most people who end up working with me, they know, right? They know that there's a lot that's out of their control and they can do everything right. And still things happen. Things happen. And so when they come to work with me, they come from a place of, I know that can be true, and I want to add one more kind of block to stack that deck in my favor. I just want to do one more thing to make sure that I'm addressing this, because now that I know this is a factor, I don't want to look back and say, why didn't I do this? And also I recognize I can do all of it perfectly and still something could happen. It's being able to hold both.
Yeah, absolutely. Well, tell me about Ruvelle. So this is new since you and I last connected, because I've always told people about your book or told people about Delivering Miracles, but tell me about the company, Ruvelle, and what it's offering.
Yes. So Ruvelle is the culmination, I think, of all the years of client work that I've done. I love my clients so much. I've had such a wonderful experience working with them. And I know that work can reach more people. And I was always trying to figure out, how do we do that? And it's not a course, and it's not a workshop, and it's not a training, and it just never felt right. And what finally came to be was, well, it's an experience. We need to be able to experience what it's like to be safe, to be heard, to be seen. It addresses this idea of, say, anxiety, for example, from all different root causes of it, right? That anxiety can come from not understanding what's happening to our bodies. It can come from having providers who don't listen to us. It can come from experiences that we have, lived experiences, and we've been pushed to kind of forget and go, but everything's fine now. It's, the uncertainty of it. And we kind of look at all the different facets of what feeds this experience. And then we combine that with the idea of, well, what do we want? We want to get pregnant, we want to stay pregnant, and then we want to raise children and pass on this generational health so they don't have to recover from as much as maybe we're having to recover from. And that's what Ruvelle really is about. And so we do have courses, of course, little mini courses there just to get tasters of what somatic work really is like. We have a new journal, a body language journal that dives a little bit deeper into what we talked about today, which I think is really fun. And we're about to open our private members club, which is going to be be open for everybody. If you're trying to conceive, if you're currently pregnant, if you're done, if you're parenting, if you are living with the impact of medical trauma on your health, and really knowing how to create a lifestyle of health and wellness and healing is really what it's all about. So I'm super, super excited about it.
Ah, that's amazing. What can someone expect, I guess, if they were to do the workshop? Would it be, online? Would it be working with the journal that you have? Like, how does it work?
Yeah, so you have choices, and that was so important to me. Is one of the things that we kind of started with is where can we bring back choice? And so you decide what it is that you have the capacity for. Do you have the capacity for a journal and that's kind of it? Great. If that's a course, great. If you want the whole experience, you come join us in the club and we'll walk you through all the different aspects of supporting your health and your health care and building out your team so that you have the support that you need for whatever it is that you're going through. But the intention is always, always you get to choose what you need at what time.
It's fascinating and fantastic. And I love that you're reaching people at different stages of their journey in different ways, because everyone is so unique and what their needs are. And it's just absolutely amazing.
Thank you.
I absolutely love what you're doing. And it's so much, Parijat. You are helping people in so many different ways. What keeps you going?
I would say it's the hope. Honestly, that sounds so hallmarky, but I mean it. I
Yeah.
mean it from a physiologically backed way. Like the reason I do this work, and we talked about this at the beginning, I need to understand why something's happening. And when we can understand, and when I delved into the research and found, wait, there is a physiological explanation for stress and stress induced health issues, and this is how it makes sense, and there's a logical pattern to it, then the flip side of that is there's hope. There's no magic solution. There's no crystal ball. There's no magic wand. There's nothing that, you turn the switch on and everything's suddenly better. My gosh, I wish that were the case. I know you do too with your patients, but what we have is hope because we have power.
Mm-hmm.
We have choice. And we may not have the best choices. I've been in so many situations on our family building journey where we had to make choices between two awful options.
Mm.
And it was still our ability, if we can give ourselves the power to choose and say, I don't like either one of these things, but I will choose A over B because of X, Y, and Z. We get to take that power back. When we take that power back, we get to tap into what's possible physiologically. And I will never be WNBA height, but I can change what I can change within the little window that I've been given. And I think there's something really powerful in that. I really do. And it's that hope to see people having different experiences in their next pregnancies, through their next IVF cycles, through their next fertility cycles. The whole experience is just different when you know, wait a minute, I matter and I'm seen and I'm heard and my lived experience matters and I can actually change or alter what that experience is, whether it's how I feel with my doctor, how I feel leaving the appointment, how I prepare for an ultrasound, how I prepare myself for results. I have power in that. And I think there's a lot of hope there.
Well, and I see someone who really went through a traumatic experience family building. You were already in therapy as far as like helping others. You had done a lot of research looking at it sort of from an academic focus. And then you had this lived experience. And I feel like you're taking everything that you've learned and experienced and you're using it to help others. And I just appreciate that so much. And even if someone is not planning to try to conceive again or isn't pregnant and facing a high risk pregnancy, I think doing this work can improve their overall health for the rest of their life. It doesn't have to be
Yep.
focused on a very specific goal. And I think it can really heal a lot of past trauma. And you're doing it, you have such a unique niche. I mean, people have heard things like this before if they're familiar with mindfulness and getting in touch with your breath and your surroundings and pulling yourself into your body to be aware. That's a lot of somatic work. But what you're doing is doing it for, specifically health trauma, a lot of pregnancy related, fertility related trauma. And that is such a area of absolute need. And I just can't thank you enough for being on the show today and reconnecting with you. And please tell the listeners how they can find you.
Absolutely. Well, thank you so much for having me. First of all, I was thrilled, so excited that we were going to be able to do this. Best way to reach us is through the website, ruvelle.com, ruvelle.com. And then all our links are there, everything to our club, the book, the podcast, our socials. I mean, everything is linked from there. So that's the best place to go.
Great. Well, and we'll absolutely put that link in the show notes so that everybody can find it easily. And Parijat, again, so good to connect with you. Thank you so much.
Thank you.
I hope you enjoyed this conversation with Parijat. I think it is so extremely important to understand not only how to cope with anxiety and all the emotions that come with your family building journey, but understand the process and what's going on physically in your body when you're having these feelings. If you can understand the process, you can really learn even better coping and strategies for decreasing that stress and that anxiety. I loved how much we learned today. Find this episode and all others on my website, drlorashahine.com. You can find more educational material on my YouTube channel, on Instagram, on TikTok. Please send us an email at hello@drlorashahine.com. You can ask questions. You can give us ideas for topics you'd like us to cover and anyone you'd like us to interview. We are looking for some input from you. We want you to enjoy this show. Thank you to our friends at Seattle Sperm Bank and Braze Run Production for sponsoring the show. Thank you to my producer, Shannon Perry, and her wonderful team at Audiotocracy. This is your host, Dr. Lora Shahine. See you next week. And until then, wishing you love, luck, and pineapples.